In today's time, kidney stones are becoming a common problem. There are many reasons for this. How are kidney stones formed? Before knowing this, let us understand the function of kidneys in our body. Functions of kidney. The main function of the kidney is to remove excess water and odor from the body through urine. Tubes called ureters carry urine from the kidney to the bladder. The kidneys are located just below the bones below your chest and on both sides of the spine. They are shaped like kidney beans. Kidney stones are solid deposits made of minerals. Their size can range from as small as a grain of sand to as big as a golf ball, and there are many types of them, depending on the mineral that forms them, such as calcium oxalate, calcium phosphate, strohite, uric acid, cysteine. How kidney stones are formed. When the kidney filters these minerals, they sometimes join together to form small crystals. Then these crystals join together to form stones. These stones are formed in the kidney where they continue to grow bigger. Sometimes these stones pass through the ureter and come out with urine, and sometimes they remain in the kidney, where they grow up to 4 to 5 millimeters, which may be a little big to pass through the ureter. When they become so big, the stones can get stuck in the ureter, which causes blockage in the ureter and causes a lot of pain. Pain and blockage remain until the stone reaches the bladder. After that, it comes out of the body with urine. Treatment of kidney stone. What are the ways to remove them from the body? First of all, we observe. In observation, we wait for the stone to come out with urine on its own. The smaller the stone, the more likely it is to come out on its own. The advantage of this process is that you avoid surgery, and the disadvantage is that it can become even bigger, and can cause pain and backache. Treatment of kidney stone. If the stone does not come out on its own, then an operation has to be done. So let's talk about surgical options. Shockwave lithotripsy. Energetic shockwaves are sent towards the kidney while passing through water. This breaks the stone into small pieces which easily come out with urine. The advantage of this is that you neither have to be admitted to the hospital nor any incision is made. But after getting this done, you may have nausea, vomiting, pain, blood in urine and pieces of stone for several weeks. Uretroscopy is in this. A small instrument called ureteroscope is inserted into the urethra, which reaches the stone through the blender and then the ureter. Here the stone is broken with a laser fiber, and the pieces are taken out through a basket. The patient is made unconscious and the operation is done. A stent is used to do this. A stent is a 10 to 12 inch long tube made of soft plastic. It is left inside the ureter for a week, so that it remains open. After a week the stent is removed. The advantage of this procedure is that no incision is made, and the stones which are not broken by shockwave lithoscopy are broken by this, but there is a possibility of infection and injury due to this procedure. Percutaneous nephrolithotomy. In this, a small hole is made in the back, through which the tube is inserted directly into the kidney. This is an easy way to break and remove the stone. To do this also, the patient is made unconscious and a stent is used. The patient has to be admitted to the hospital to get PCRL done. Its advantage is that this is the most successful procedure among all the 3 surgical procedures, but it carries the risk of infection, sepsis, and bleeding. When is the risk of stone formation the highest? Disturbance in metabolism, such as high absorption of calcium or increased calcium in urine, drinking less water or dehydration, wrong diet such as high sodium or eating too much animal protein. Some medicines such as acidity medicines and supplements, like vitamin C, calcium and vitamin D, can also cause this problem.